Good morning, everyone. My name is Shah. I'm a cardiac electrophysiologist in Richmond, Virginia. I work with the electrical system of the heart that specializes in unexplained fainting and cardiac arrest that can happen to patients. As a lot of you may have seen or read in the news, that there was a star player who collapsed suddenly during a soccer match over the weekend. This was a difficult thing to witness on national TV. But what we know so far is Christian Eriksen, who is arguably the best soccer player on the Danish team, collapsed suddenly during the match. He was successfully attended to by medical personnel who administered CPR and were able to get his heart back to normal, and thankfully he seems to be doing well. I've gotten lots of phone calls and texts from colleagues and patients surrounding what could have happened, so we figured we would put this out there so patients can be more informed. The first question is, why do athletes who are in prime of their athletic career collapse suddenly like this, and how can someone not know about this? Well, this is a very difficult thing to sometimes figure out. There are some common arrhythmias that can happen that you can pick up on EKGs and things like that, but there are some genetic cardiomyopathies and things like that that need a little bit more evaluation, and frequently you may not know this unless you've had the proper evaluation. Now, I don't know the details about Christian Eriksen's background or if this is something that has ever happened before, and I'm sure he's going to undergo a thorough evaluation for this. The next thing we want to talk about is, how quickly they were able to attend to it, and what you or I can do if we're in the field at any athletic event. It doesn't have to be a professional event, a high school game, a soccer game, a college game, and what to do so that you can help someone. The key here is you have to attend to the individual who arrests immediately. And as you're trying to do that, send somebody else who's nearby to ask for help. The basics of BLS is to get help right away and start and evaluate to see if the patient has a pulse. If they have a pulse, then the first thing you should do is to do CPR for 2 minutes. And I would encourage all athletic coaches, trainers, folks that go to games, even most people should know how to do CPR. That's a valuable skill that can save somebody's life. And then after about 2 minutes of CPR, you're supposed to check for a pulse again. And if there's not a pulse, hopefully you can get an AED. So if you ask for help, somebody can be getting an AED, and you're supposed to apply this, and this is relatively straightforward as to where they go. And then luckily these things have improved significantly where they can detect the rhythm and can shock somebody back to normal. There's a lot more to this, but this is just kind of a brief overview. The last question is, how likely is it that Christian Eriksen is going to make a recovery? Thankfully, with a lot of these, and again, I don't know any of the details surrounding him, if you are able to attend, provide quality CPR quickly, patients can make a very good recovery, and I'm hopeful that Christian Eriksen will do the same. Thank you.